Hi, I'm Phil.
Hi, it's Bindy.
So today we're going to talk about ingrowing toenails. So if you look at this gross picture behind us, this is an ingrowing toenail. And the question we're going to answer today is, should you have antibiotics for your ingrowing toenail? So a lot of our patients will come in and have had a sore toe like this for days, weeks, months, sometimes years. And often patients will ask, should I get antibiotics for this toenail? So Bindy, if you saw a toenail like that, what would you recommend?
Straight away, address that with some antibiotics, but we do need to get to why that's happened, what the cause is, and it's really because there's an offending edge of nail there that shouldn't be there, and we need to remove that. So short-term antibiotics, practice good foot hygiene and redressings, and that's something that's important after surgery as well, not just before. But
Afterwards as well.
Yeah,
so when you look at that, you can tell that that's infected?
Yes, it's got
what
all
is
the
it
features.
that looks infected to
so
you?
the features are the localized redness, slight swelling, pain. You can see the skin flaking around there. There's weeping from the wound, and you get this what we call hypergranulation tissue sometimes forming.
Yeah. So that one is, you definitely be looking for some antibiotics. Sometimes, do you ever see ingrowing toenails that don't have infection?
Yes, sometimes they can be mild, a bit more superficial, where there's just a little bit of redness. Call that sort of paronychia, where it's just only just starting. Yeah.
So if it's infected, it needs antibiotics. If it's not infected, it doesn't need antibiotics. But all ingrowing toenails will require, I suppose, the removal of the offending edge of toenail. So if you were to do a procedure for what are the options for treating a toenail like that, with either surgically or otherwise?
So where you've got just one side that's sore and the other side's okay, we just need to do a surgery procedure where we cut out this side of the nail and treat it with a chemical called phenol, which stops the nail growing back, and then wait for the healing process, which can take about 3 or 4 weeks. But
people can be back in footwear within how long do you generally find?
We have a review after a couple of days, but they can usually, provided the footwear isn't irritating the area, then you can wear footwear probably the next day, as long as it's not aggravating it.
I did a few procedures yesterday, and I had one of the teenage child, and he was back in his shoes, the next day. So it's often, if that's your toenail, right? So if you're at home with a toenail like that right now, if you call us today, come and get a procedure, your pain tomorrow will be much less than it is today, because you can see that there, the infection, but also the nail that's digging in and causing that pain. So I think people, when they come in and see us at our clinic, the most common thing that people say to me after their surgery, right straight away, is they say, I don't know why I didn't do this sooner, because the pain they've been putting up with for weeks, months sometimes, it's just instantly alleviated.
So removing the nail, but the antibiotics helps with a little bit of pain as well.
Absolutely,
it's addressing both of those things.
So removing that offending nail and then dealing with an infection. It's surprising the number of people, once you remove that edge and then just give some topical or some antiseptic agents to the nail itself, you don't actually have to take antibiotics. Bindy, have you ever seen people who've had multiple courses of antibiotics for nails like this?
Yes, quite often. It's usually down to the fact that they've maybe not been redressing it and managing it very well. A sterile, clean, dry dressing is really important. It's more about the prevention of the infection as well than, you can keep on having antibiotics, but if you're not managing the wound and making sure that nothing's getting in there, because if something's coming out, if your wound's weeping, then something can get in there too. Absolutely, and then it's just the infection that can then spread down and then become quite serious sometimes. There was actually a tragic case of a young boy out in Western Queensland who actually died from an ingrown toenail that wasn't treated very well quite recently, and that was in the news quite recently. So it is a severe and important thing. So if you have a nail like this that's infected or giving you pain, it's something we should really look at. And
having ongoing courses of antibiotics trying to fix it won't fix it if there's the edge of nail digging in. So, okay, so we've talked for 5 minutes now. I think that's enough. If you've watched to the end, well done. You've probably got a sore toenail, so give us a call. Come in and we can fix it. All right, thank you for watching.
Thanks. Bye.
Bye.